So this past iwCLL in Boston that was recently held, I presented a poster, or what's called a trial in progress, where we release a study design and discuss enrollment status at that point in time. And this clinical trial is looking at using Zanubrutinib in combination with Venetoclax as an initial therapy for patients with CLL who have treatment indications. What is unique about this study is a few things. One is that it uses once daily dosing of Zanubrutinib. Most clinical trials have used twice daily dosing, even though we believe and we do have evidence that it's equally effective as once daily. It obviously makes taking the drug easier as a once daily drug. So we're exploring once daily dosing in combination with Venetoclax, of which there's very limited data in terms of that combination, once daily with Venetoclax. The other unique aspect about this study is that it's a response-adapted clinical trial. And so we are going to enroll 50 subjects, 50 patients, and treat them with a year of combination therapy with the standard 3-month lead-in with the Zanubrutinib, at which point they then get reassessed, and then they start 1 year of combination Zanubrutinib and Venetoclax. At the end of that 1 year, patients will then undergo a bone marrow biopsy and peripheral blood MRD testing. And if they are MRD negative, they will stop treatment at that point in time, being 1 × 10⁻⁴. If they are MRD positive, we will then continue on 6 additional cycles of Zanubrutinib and Venetoclax, but with the addition of an anti-CD20 antibody, Obinutuzumab. The hope and expectation is that we'll convert most, if not all, patients to an MRD negative state by the end of their combination therapy, whether it's 16 cycles or the 23 cycles. And additionally, what's unique about this is that much of the toxicity of these regimens actually does come from the anti-CD20. And so what we frequently see in trials is that they use all 3 drugs for every single patient that's enrolled. And we know that Zanubrutinib and Venetoclax by itself can convert many, if not most, of these patients, close to anywhere from 60 to 70% of the patients, to a deep MRD negative state. Therefore, we don't need to probably treat every single patient with the antibody. And therefore, we hope to maximize MRD negativity for all patients while mitigating toxicities and potentially overtreatment of the antibody to a significant number of patients. The patients will then be followed going forward, and that's really the impetus of this study. And it's enrolling very quickly and nicely. And as of now, what was reported was 10 currently dosed patients, but we're up to 15 currently dosed as of today in mid-October.